Alright.
Ready? Hi, my name's Carolyn, and I understand you've come in today for me to do a complete body assessment. Is that correct?
Yes, ma'am.
Just check everything out and make sure you're doing okay. Alright. Well, we're going to start off. I'm going to explain to you some of the things I'm going to be doing. It's going to require you sometimes to stand up, sometimes to sit down, sometimes to lie down. I will be touching you in different places. Nowhere personal, okay? And I'll be touching your head, pretty much every part of your body, okay? I'll be listening with my stethoscope, different parts, and things like that, okay?
Yes, ma'am.
Okay. We're going to start with your skin. I'm going to be talking out loud to like narrate my nurse's note, so you're going to hear me saying things, okay? All right. The skin is palish tan in color. There is a tattoo noted on the right bicep. If you sit up straight for me, okay. There's normal male hair distribution on the chest, stomach, and legs. The skin is warm, equally warm bilaterally. Okay. Can you hold your hands out? We're going to look at your fingernails and toenails, okay? The fingernails are neat, clean. They are of short length. Capillary refill on the upper extremity is less than 3 seconds. If you'll take and do your first 2 fingers like this right here, okay, this is shamrock technique. It's assessing for clubbing. The angle is about 160 degrees. There is no clubbing noted. There's no spooning noted, which is a sign of iron deficiency. Man, I'm not through with your hands yet. Go on. Okay. Turgor of the skin is good. It rebounds well. It looks very well hydrated. The texture is smooth. It's dry, but not excessively dry. Okay. Now let's look down here. There is a red macule noted on the anterior aspect of the left calf. Skin is warm, equal bilaterally. Turgor is good on the lower extremities as well, rebounds well. Capillary refill is less than 3 seconds on the lower extremities as well. Toenails are clean. They're of good length, short. There's no nicks or paronychia noted on the upper or lower extremities. Okay. Now I'm going to be looking at your head and your hair. Okay. Hair is coarse, thick. It is clean. There's no flaking noted, no infestation noted. The scalp has no lesions noted that I can see. It's slightly movable with no crepitus noted. The head is symmetric. It is midline. It has good proportion, size, in proportion to the body. You don't have any pain anywhere, do you? In your head? Okay. The occipital, frontal, and parietal bones are notated and firm. The skull is intact. There's no lumps or bumps. All right. We're going to look at your face and your eyes and your ears, your mouth, and all that, okay?
Sure.
Okay. The pinna of the ear is equal to or level with the outer canthus of the eye bilaterally. The nose is midline. The eyes, the globes of the eyes are equal and equal distance from the nose. The eyebrows extend past the outer canthus of the eye. We're going to do some tests on your eyes. I'm sure you've seen this. This is the Snellen chart that you use at the eye doctor where they ask you to read the letters. And they tell you that your vision is either you have good vision or you're nearsighted or farsighted, need glasses, things like that. And you measure it with a fraction, and perfect is 20/20. So, and then for near vision, if you need bifocals, they use the Rosenbaum chart. You hold it about 14 inches from your eyes. You read the lowest line you can read. Perfect is 14 out of 14. Okay, I'm going to dispose of these so there is no paper anywhere. Okay. Let's do some things with your eyes, if that's okay. Okay. The eyelashes are, they point outward and upward. The eyebrows are consistent with the hair on the head. I'm going to just touch your eyes. If you'll close your eyes for me. Okay. The eyeballs are firm. The lacrimal sac is intact and firm. Okay. Open your eyes for me. The palpebral fissures are equal. There's no ptosis noted. Alright, we're going to do some tests that assess your eyes. Okay? Alright, if you will excuse me. If you will let me shine this bright light in your eye. Okay? That's always fun. Okay, we're going to start from back here. Just look straight at my nose. The corneal light reflex shows the twinkle in the eye is equal distance and in the same spot in both eyes. Okay. The iris is brown. The lens is clear. The sclera is white with vasculature noted, but no redness or hemorrhaging noted. I'm going to gently look at your eye up underneath your eyelids. Just relax. The conjunctiva has no exudate. It is mildly vasculated, normal vasculature. The eyes are moist. The blink response is good. Okay. If you will close your eyes and try not to let me open them. These are some tests of the cranial nerves. That is the testing the facial cranial nerve. Okay, if you will open your eyes and look at me. Alright, one of the things I want to do before we get started completely looking at your eyes is assess the rest of your face. Open and close your mouth for me. Okay, jut your jaw forward, pull it back, now jut it forward and go side to side. Do you feel any pain when you do that? Okay, there's no pops or crepitus in the TMJ. Okay, if you close your eyes for me, I'm going to touch a couple of places on your face with something soft and something sharp, and you tell me which you feel. Is that soft or sharp?
Soft.
Okay. Soft or sharp?
Sharp.
Okay. And you would do that on several spots on the face. Okay, you can open your eyes now. Alright, if you will do what I do, I want you to smile without your teeth showing. Okay, now smile with your teeth showing. Now, act like you're giving me a kiss. Purse your lips. There you go. Alright, puff your cheeks out. Put your tongue in each cheek for me. Okay? And now stick your tongue out and move it side to side. That's assessing the hypoglossal cranial nerve, which is the 12th one. We were assessing the facial nerve just then, which is the 7th one. Okay. We've also assessed the trigeminal. There was good muscle tone felt here, and then when I was touching your face, that assessed your trigeminal cranial nerve. Okay, now we're going to do some more things with the eyes. Okay, if you would, okay, the pupils are, like I said, they are equal, they're round. If you will look at this, and just as it gets closer, just, okay, the pupils accommodate well. Alright, now, they do react to light, and there is consensual constriction, so that is good. Yeah, no, that's bright light, isn't it? Okay, now we're going to assess, that was the the cranial nerve. We're gonna it's the abducens, the trochlear, and the oculomotor. There's 3 of them. I had to think of the name of them. Okay, I'm gonna move this around, and I want you to just follow it with just your eyes. Okay. All right. Very good. Okay. Very good. That's the 6 cardinal gazes and that assesses the oculomotor. Okay, now, there is nothing written on these. These are blank. We're going to use these. One of them is called the cover-uncover test. I need you to just look directly at me. Okay? Just keep looking straight at me. Okay? The test is normal. The other eye was looking at me when I removed the card, and you would do that bilaterally. Okay? Now, I want you to hold this card up over this eye for me. Cover your eye. I'm going to cover the same eye. Here's the bunny. This is called confrontation. It tests your peripheral vision. I want you to tell me when you see the bunny. Okay?
See the bunny.
Okay.
See the bunny.
Okay.
See the bunny.
Okay. Here we go. And you would do that bilaterally. Okay. All right. I'm going to be looking in your eye, which is going to assess the optic nerve, optic cranial nerve. Okay. I put my hand on your forehead here. Okay. The red reflex is good. There's no dots. The lens is clear. Take my glasses off. Okay. My diopter wheel there. Okay. Alright, I see the optic disc. It is creamy yellow. It's rounded. There's no cupping. The arterioles are brighter than the venules. They are in approximately a 3:5 ratio with no crossing or hemorrhaging. The retina is purplish red. And there's no hemorrhaging or exudate noted there. There is the macula densa, which is the area of central vision, which is lateral to the optic vessels. And in the center of that is a white dot, the fovea centralis, which is the area of sharpest vision. Okay, very good. All right, now we're going to look at your ears, okay? The helix is movable. The auricle is fine. I'm mashing on what's called the mastoid process. Do you feel any pain there?
No.
Okay. All right. At this point, we're going to break, and I told you it would be in 3 parts.